Okay, great. Thank you, everybody, for joining us. I'm Phil Bridges with UNC Health Communications. This is our, I can't remember if it's either 19th or 20th media briefing that we've been doing since COVID began. And the idea is to provide you with interview subjects and the ability to get as much information as you can from those folks while we're doing this. And we found this to be a good format, and it works for us. So we are recording. At the end of the briefing, we'll post a recording of the video and of the audio separately. So if you're in radio and television, it can make a difference for you. We'll put those on a Dropbox, and then we'll also upload the video to YouTube as well. And hopefully we'll have those, within 30 minutes to an hour of the meeting being over. So they'll be useful for you. And we do that in an unedited format. So moving right along, we'll get to our experts today. Our main purpose in today's briefing is to talk about the Heroes Health app, which Dr. McLean will talk about, but we also have some frontline providers, some healthcare providers from UNC Health that will also be here to talk and to take questions as well. So for the formal introductions, I will hand it over to my colleague, Alan Wolf. Alan?
Hey, Phil, thanks for letting me be your sidekick. Our featured experts today, I'm proud to work at UNC because I get to work with folks like this. UNC physician and researcher Dr. Sam McLean is currently vice chair in the Department of Anesthesiology, attending physician in the Department of Emergency Medicine at UNC Medical Center in Chapel Hill. He brings a unique perspective on this pandemic, both as an ER physician and a COVID survivor and a passionate researcher. And joining Dr. McLean are two frontline health workers at UNC, Rebecca Tallman and Joshua Deal. Joshua is a nurse manager in the UNC Emergency Department. Rebecca is a talented nurse at UNC Hospital. Dr. McLean, I'll let you kick things off and introduce your colleagues.
Yeah, thanks so much for having us today, first of all, and appreciate everyone joining. I'm here today to talk about two things. One is an initiative that we've just started at UNC to support frontline healthcare workers and first responders during the pandemic, and really to support their mental health, given all the challenges that COVID workers face these days. And so I'm going to talk a little bit about that, and then introduce my two wonderful colleagues here to share a little bit about their stories and their work in these past months. So let me talk a little bit first about the app that we've developed. So I was fortunate to work with colleagues at Google and contact them in March when I was working in the COVID unit about developing an app that would support the mental health of frontline workers. The folks at Google and so many folks across UNC and friends at other academic medical centers worked together to develop this Heroes Health app. The Heroes Health app is free and available through the App Store or Google Play Store, and it pushes a 5-minute survey, mental health survey or assessment out to frontline workers as we sign up for the app every week, and gives them a brief assessment of their anxiety, depression symptoms, stress, sleep, and then gives a very simple picture readout of what their symptoms are like, and also then lets them see trends over time with how they're doing, and very importantly, links them up via immediate links to resources. And that's available nationally to any healthcare worker in the United States. And again, it's designed for first responders and healthcare workers. It also, at organizations like UNC Chapel Hill that have partnered with the initiative, it provides aggregate group level anonymous feedback from all workers to leadership at organizations or hospitals, so that it lets those leaders understand how are the nurses in the ICU doing, how are the environmental services workers in different parts of the hospital doing, and lets them sort of keep track of how their workers are doing, because as we've seen, these waves of the pandemic move through that put tremendous strain on folks who are already under a lot of strain, like it's going on today in Miami or in Houston. It's really valuable to be able to keep tabs and to be able to provide institutional support to areas of the institution that need it. The app also allows people to share their information confidentially with a mental health resource at their organization, and then that mental health resource can reach out and touch base with people with symptoms and offer support or referrals to care. So very pleased to be rolling out that initiative both here at UNC and nationally, and just did so yesterday. My colleagues here today with me really exemplify both the some of the incredible people and the incredible work that COVID workers are doing, and also the challenges faced by COVID workers. Josh is not only a nurse in the emergency department, but also one of the nurse leaders, and he himself has type 1 diabetes, which puts him at higher risk of COVID-related problems, but he's still out there every day taking care of patients and serving the community, and just a wonderful frontline provider. Rebecca Tallman, who's on with me, has two fantastic kids, one of whom has special needs and is particularly vulnerable to the effects of COVID potentially. And so when she was working in the hospital recently this spring, really went through a very difficult struggle of whether to self-isolate, and ultimately chose to do so, living apart from her kids for an extended period of time. So unfortunately, the sacrifices that Josh and Rebecca are making and the challenges that they're under, mental health wise and just in general life wise, are not uncommon, but I think they're two terrific folks from UNC who really shine a light on the wonderful work that so many people are doing, both here at UNC and across the US, in trying to take care of people in society who still need someone to come and serve them when they're struggling to breathe in the middle of the night or have a medical problem of any kind.
Great. Thank you so much. We'd like to open it up to media questions. So if anyone has questions, as we always do, just step right up to the microphone and ask away. Well, I can get it going a little bit here. Dr. McLean, one of the interesting points here to me is that that you and Josh have both had COVID. Could you talk a little bit about that and how that prompted or inspired you to create the app that we're talking about?
Yeah, I initially began working on the app and started to develop the app prior to getting COVID myself. But and my colleagues at Google who are working on this like to joke that I was like, I'll be there every day, I'll be doing most of the work. And then like the next week, I kind of disappeared for a week and a half, and they did most of the work until I was back after a couple weeks. But it's certainly, there is no education like personal experience. And I think one thing that is experienced by most people who have COVID is there is a very distinctive sensation of having a difficult time getting a breath in, and a sense of not being able to breathe, and a sense of constriction. And that is a very, until you've experienced it personally and seen loved ones also struggle with it, it really is different than appreciating it, conceptually. And having that firsthand experience of finding it difficult to breathe is something that I certainly will never forget, and redoubled my interest in providing something during this time.
Rebecca, Josh, can you talk?
Thankfully, I have not had COVID.
No, please, yeah, go ahead. Go ahead, Josh.
No, thankfully, I have not had COVID. However, taking care of people that do is eye-opening, and not only because of their health, but because of the fear of never having this disease before. And people are just, it's more difficult to cope with this disease, I think, than other things, because they know friends that have had the cold or pneumonia or cancer or anything, but COVID is just so new. So it plays a toll on these patients' mental health, almost just as much as it plays a toll on their lungs and their breathing and everything else, I think, just because everyone's so new at this.
I think that's one thing that's made it very satisfying for all of us as providers, is the opportunity to comfort people and to reassure people and to be there for people when they're experiencing COVID, because it is so scary, because we're all been inundated, understandably, with news 24/7 about all of the deaths and the illness and the worst cases, so that when people get it, it really strikes fear, as Josh is saying.
Rebecca, would you like to jump in and just and sort of describe what's been your experience?
Sure. As a mother and a single mom, a mother of two, and a healthcare worker, not only taking care of myself, but making sure my kids are mentally healthy, and also being there for patients who are really struggling and separated from their families. You really have to stay strong, and a lot of our support systems that we usually lean on are not available. Gyms are closed down, unable to see friends and family. It's really important that you have some way to take care of your mental health to provide for others.
When you were, can I ask you, Rebecca, when you were going through the decision process or struggling with trying to figure out how to work in the hospital and best protect your kids, how did that, can you describe a little bit sort of like what your thinking was, or how you were, what you were, trying to figure out, and thinking back to that time?
It was actually a pretty easy decision. I knew that we didn't know a whole lot about COVID, and I knew that I had to protect my children. I did not want to bring anything home, so I was able to move them out of the house for an extended period of time and watch out for them, and also to protect my friends and family that I don't live with, not being around them, staying 6 feet, wearing a mask. And if you are seeing someone going for a walk, you're 6 feet apart. So it was actually a really easy decision to protect the people surrounding me.
And then how would you talk to your kids during that time? Did you have like a daily FaceTime or a daily?
Well, we actually, on the days that I was doing, so I usually work 8-hour shifts, but I was working 12-hour shifts. So during those days, I would not see my children. But on my days off, we would 6 feet apart on the front porch. We camped out in the backyard, 2 separate tents, and wearing our masks, just checking in.
That's awesome.
They're laughing and seeing what they're up to.
Yeah, it's such a great example, like the camping out, of all of these creative ways that moms and dads who are COVID workers are coming up with to try to be really engaged with their kids and be there for their kids as much as possible, while also keeping that separation and trying to keep them safe. So this image of your 2 tents in your backyard with you in your one and your kids in the other, and trying to, being distant from them, but being there with them is fantastic. And I think
moving the TV out on the porch and staying 6 feet away from my kids as we watch their favorite TV shows.
That's great.
And bike rides. Yeah.
And like, as you and Josh and I know, when we hear that numbers are going up in an area or that places are turning into hot spots, we just picture so many families and so many caregivers going through those exact same things that you were doing. So many people moving into Residence Inn or local hotels, or doing the kinds of, you're gonna now move out to a friend or family members and not be at my house, but we'll meet on the porch, or let's camp in the backyard. That is playing out, in just tens of thousands of times all over this country, and it has. And I think it's wonderful, but I think, as we know, it's hard. It's not easy to not be around your kids, or it's hard to see the sadness that we see in the hospital, or the challenges. And certainly for me, I think the stress levels that I've seen in colleagues have been, far different and qualitatively different than anything in my previous 20 years of emergency medicine. Seeing a nurse just come to tears for just like being overwhelmed by the situation for a moment, or people needing to take 5 or 10 minutes to go and just take a break a little bit.
Completely, patients are separated from their families that are usually their support system. So we turn into their support system, and we are very, very sick and having to say goodbye to loved ones, with a short period of time or over FaceTime. And then nurses and doctors, everyone having to take that home, finding a way to cope with that.
So I just want to jump in real quick in case we've got, we're happy to keep the discussion going, but media members who are joining us today, do you have any questions that you would like to ask of any of our guests?
I've got one. This isn't exactly on topic, but it's pretty closely related.
No problem. That's fine, Jason.
This is Jason DeBruin with North Carolina Public Radio. So I'm in the middle of doing a pretty big story that's going to look at homicides and violent crime during the coronavirus. The evidence is, I think, pretty clear that the mental stresses brought on by COVID, among other things, are contributing to an elevated violent crime rate. So being that you are in the emergency room, I wonder if you are seeing some of these trends already, and if you might offer some comments generally about how the coronavirus and perhaps even, some heightened tensions around the protests and what that might bring, if that's perhaps contributing as well.
Josh, you want to?
Sure. I have not noticed any trends of homicidal ideations or anything like that. However, mental health in the emergency department has always been a very large part of the emergency department, just because we're kind of a safety net for, people. And right now we are seeing a definite surge of people seeking mental help. Stress, anxiety is huge. Suicidal thoughts, suicidal ideations, suicidal attempts is big. And it's not just the COVID patients that we're trying to take care of, it's also the large mental health population. And we've got a great team in the emergency department, full of nurse practitioners and doctors and counselors and social workers to help out with this, but it can stress the department a little bit with how many different types of mental health patients come in. So unfortunately, I don't think I could say anything specific towards homicidal or anything like that, but just mental health in general has definitely gone up, especially these past few weeks since we've had kind of this surge in North Carolina and different states of COVID, I think.
It makes sense, and I think this epidemic of this pandemic of COVID then spawns a pandemic of unemployment and economic collapse, and then we have long overdue, recognition of the ongoing injustices in society happening concurrently, and it just makes perfect sense that it would be really the perfect witch's brew for also spawning mental health crises and then also crime and violence. So it's great that you're shining a light on that, Jason, because it's all happening. It's many stories.
Dr. McLean, could you talk a little bit about how, when you were working, I know you work with Google and a lot of other folks to put the app together. Could you talk about working with, say, for instance, the UNC psychiatry folks and what their input was and what, because that's not your specialty. Could you talk about that a little bit?
Right. Samantha Meltzer-Brody is just an incredible human being and is the chair of the psychiatry department at UNC and a national leader in wellness and employee wellness. And she has really been, breaking ground with innovative programs for many decades, and was very fortunate here at UNC to be able to link and partner with our app with her wonderful Heroes Health Helpline and UNC Wellbeing Program. So she already had a program of people or a team of mental health providers who were very expert and had a lot of expertise in offering crisis support, referrals to care, and it's been great to work with them. Rebecca Nash is also a terrific young faculty member and psychiatrist, and definitely those are the experts. And our goal is to get information from the users, organizational workers who choose to share their responses, their app responses. So when you go in and sign up for the app, and then every few months afterwards, you can select or elect whether or not to share your personal information in terms of your personal responses. Those who do, that information is confidentially shared with a mental health support team, who then are able to perform outreach to those folks. So in terms of the type of outreach and the sort of standard methods that are used. They are so polished and expert with those things. And it's really been terrific to partner with them. And then as we sign up other organizations, and as you know, we have organizations all over the place that are signing up to use this, they're really becoming the trailblazers and sharing their methods and procedures with lots of other organizations and institutions who are using the app in a similar way. So they've been nothing but fantastic and really make the program.
I have a question.
Sort of an open-ended question. As we look ahead to the fall and even beyond that, flu season, what would the three of you want to say to the general public about what needs to be done? What should people be doing?
I think in terms of the spirit of the app, I'll let Rebecca and Josh share their thoughts. In terms of my thoughts, I have two. One is that in terms of the spirit of the app and the goals of the app, which really are general, also general principles, is, you know, keep track of your mental health, keep an eye on how you're doing, because this is a difficult time for all of us. And if you're having difficulties, if you feel like you're not sleeping, or that symptoms of sadness or anxiety are affecting your quality of life, look up and see what your local resources are. There's lots of resources out there to take advantage of. And then the other thing I would say is simply, it's still really difficult, you know, amazingly, for all of us humans, and I say that as us humans inside, to wear a mask. Like, it's amazing, like going out this last weekend, so many people aren't wearing a mask, and, you know, the reason that we're in the situation that we're in is just we haven't quite done the job that we need to do as a society, and we need to wear a mask, we need to avoid crowds, and we need to wash our hands.
Hey, before we go back to Josh and Rebecca, I had a very specific question via chat. Rose Hoban is asking if you could give us more of a sense of what the app does and what's the interface like, and what types of questions are part of the screening. If you could share that would be good.
Yeah.
North Carolina Health News is asking that.
Yeah, of course. So we also have screenshots, Rose, that I can send you of the different aspects of the app, or that Phil and Alan can send in follow up. But basically, what the app does is it's available free through the App Store. You download it. It asks if you're a first responder or healthcare worker. You sign up for it through about a 10-minute sign-up process, and then it pushes notifies you every week that there's a short survey for you to complete. You do this 5-minute or so survey, which checks in on sleep, stress, anxiety symptoms, symptoms of sadness. Is your in general questions about how your mental health is affecting your quality of life, that assess that, and then also ask some questions about the personal protective equipment availability to you, and some sort of questions that are specific to healthcare workers. At the end of that assessment, you get a very brief pictorial summary report of the symptoms that you reported, and it shows sort of where you fall on the spectrum of folks. Are you in sort of the mild, moderate, or more severe range in terms of those sorts of symptoms? And then right after that, it provides immediate links to resources. So the national version of the app that anyone can use gives links to immediate, to talk to someone 24/7 immediately by text if you're feeling overwhelmed or really stressed out. Also gives immediate links if you hit a link to call someone up on the phone to talk to a crisis counselor. There's wonderful crisis centers all around the US with people that are very expert and always have someone to talk with. And then give links to other types of supports, other types of apps and mental health supports that are free or low cost to COVID workers. So that's all in the app for anyone to use. For people who sign up through a particular organization that's partnering, the first number listed is the local number of the mental health team at their organization, and also provides more sort of local focused content depending on what the best resources are in their area. So each of the resource pages is tailored and specific to the organization for people who sign up through the organization.
Two quick questions very specific to the app. One, is it only for healthcare workers? And the other is what's sort of the uptake across the outside of UNC and elsewhere? So can anybody use it, or is it just targeted for healthcare workers, and how's it spreading nationally?
Yeah, it's a great question. So it's for healthcare workers and first responders, and that's who it's designed for and intended for, and who the questions are designed for. And then in terms of uptake, we just launched nationally yesterday. I haven't seen any numbers from our team we're really focused on sharing the word and getting the word out through forums like this and other places this week and in the coming weeks. And we're glad to share information on usage nationally and at UNC. But because we just launched yesterday, we don't have any numbers yet.
Right.
What I appreciate about the app is that a lot of people only think of healthcare workers as doctors and nurses. And the app also lets opportunities for everybody in the hospital to use it, environmental services, nursing assistants, and I think that's really important. I was reading a couple of articles about environmental services who got turned away from things that nurses get for discounts, and that's not really fair. They're working just as hard in the same situation that we are. Maintenance in the hospital, man, you say COVID and they come running, and I feel like these people have they have just as much stress related to this as when you think about nurses and doctors. And I appreciate that the app includes them and gives them an opportunity to check their mental health as well.
Oh, thanks. Yeah, I think I couldn't agree more. Environmental services, if you say like, hey, this room just had a COVID patient coughing in it for the last 3 days, we needed to be, sterilely cleaned. Will you go in there and clean it and scrub every surface? They're doing a tremendous service and being heroes for sure in terms of doing that work to help the next person who comes into the hospital who's sick.
So we've only got a couple minutes left here. Any final thoughts from any of the speakers, Dr. McLean, Josh, or Rebecca, just on your experience with COVID and/or with the app?
Let me just say, I saw Rose pop up with a question about PPE and PPE supply, and does that play into stress? So it's interesting, Rose, to me, that as we saw the cases go down and we were doing better sort of in May, that PPE and PPE supply became less of an issue. And then as we're starting to spike again, PPE supply is right back there at the 4.
Shush.
Hey, Dave, you might want to put yourself on mute.
Okay.
So I think that it's an incredibly important issue. I think it's a really big stressor. I think that if you aren't confident in your PPE, if you're being asked to wear the same mask for a long period of time and you're not confident that that is going to protect you the way that it should, if you're asked to use versions of equipment, different types of, all of a sudden you've been using one type of gown that really provides good coverage of your neck and your body, and all of a sudden another one shows up that looks, clearly not as good as what you've been using, that affects you. And I think that's why we feel it's so important to keep tabs on that in our weekly app, because things can change so fast, as the folks, unfortunately, most recently in Miami and Houston have seen, and where just in a week you can all of a sudden be just overwhelmed.
Any final thoughts from Rebecca and Josh?
I just think it's really important during these times to really take care of yourself, your mental health, your physical health, still connecting with friends and family, even if you have to get really creative, getting outside and moving around, and checking on your coworkers, everyone checking in, making sure how everybody's doing, and trying to support one another.
People always think that physical health is so important, and often mental health gets pushed aside because you're just moving and don't take time. I always relate mental health back to diabetes, because I have to check my blood sugar, I have to take insulin, I have to do all these things. Using the app, I have to use this app, I have to get support, I have to do all these things to keep my mental health the same. And so it's so easy sometimes to get in that same routine of physical care that we all do, that we forget to take care of our mental health, and that's what keeps us going.
Great. Well, we are out of time. Thank you, everybody, for joining us today. We will post audio and video recordings on Dropbox, and then a video also on Dropbox, but as well on YouTube. Hopefully get those up within the next 30 minutes, depending on our internet connections. And we look forward to seeing you next time, and we'll have another briefing for you next week. So thank you so much, and we'll talk to you next time. Thanks.
Thank you.
Bye, everybody. Thanks.